Hello, welcome back to my channel, or welcome to my channel if you're new here. Hi, I'm Mel and I make videos around updates in my life as I'm dealing with ongoing issues after having blood clots in my lungs. I'm sure you read the title of this video before clicking on it, so no beating around the bush. I have an official diagnosis of CTED, which in other words is chronic thromboembolic disease. So I'm just going to give a brief update today and give you guys a little update on what is going on with me now and what to expect as this whole new thing plays out. So CTED, as I just said, it stands for chronic thromboembolic disease and it is caused by chronic clots. If you look up the proper definition for it, it says that it's a condition that occurs in the lungs and it occurs when they are affected by persistent blood clots in pulmonary circulation. I am going to go into it a little bit further, but I wanted to start by saying that this should not be confused with CTEPH, which I've definitely spoken about previously, but CTEPH is generally what is searched for when people are having ongoing issues after having blood clots in their lungs. And it stands for chronic thromboembolic pulmonary hypertension. So CTEPH is generally more well known and is sometimes referred to as just pulmonary hypertension. And in this instance, it is a lot more severe than CTED. So if you end up having CTEPH, that means that the chronic clots are causing excess pressures within your vessels in your lungs, which ultimately leads to pressure on the heart. CTED, which I have, has the exact same basis, the chronic clots, except it means that there's no evidence of hypertension at rest. I have been told by surgeons in the field that CTED is very under-recognised in the medical field at the moment, so there are a lot of patients out there possibly dealing with it, that they've just been left with these symptoms once hypertension was ruled out. And that is mainly due to a lack of evidence and studies on how to manage and treat patients with CTED. So all this came about because of the procedure that I had in my last video. Some of you watching might have come in from that last video where I had the surgical procedure, and the follow-up from that was going to be a surgical team looking at what was going to be the best option for me going forward. So I recently had a follow-up call with the surgeon in Toronto, and he basically explained to us that for patients in my remit where hypertension has been ruled out but there's still symptoms upon exertion, it's not suggested that the full-on surgery to remove the chronic clots is needed because it's so highly invasive. That surgery is known as a pulmonary endarterectomy, and I don't need that right now. So what they are suggesting is what we thought they would do is the balloon pulmonary angioplasty. So he's decided that I'm a good candidate for that procedure, shortly known as BPA. And I'm going to get booked in for that hopefully pretty soon. I've been waiting for an appointment and it hasn't happened yet, but that is the treatment that they have said that I will have moving forward. Once I get more information about all of that and when my appointment's booked in and all of the other info, I will make a video solely on the balloon pulmonary angioplasty. And I was also given information around the pulmonary endarterectomy, so I will likely make a video on that procedure as well, just from the patient's initial point of view, just to get the information out there to the masses, as it might be helpful to some people. Before I make the video solely on the BPA procedure though, I did want to note in this video in relation to CTED and that procedure, it is quite a relatively new procedure for patients that are diagnosed with CTED. Depending on where you are in the world, BPA has only been used for CTED patients from anywhere in the last 5 to 10 years. It's all very recent. The actual style of procedure isn't that new. I believe it became about in the early 2000s, but it only began to be used on CTED patients within the last decade. On the call with the surgeon who will be performing my procedure, he said that he's been doing them regularly for the last 7 years. It was like 2018 that the hospital started doing it for this purpose. And now they're very well versed in it, but it's still only 7 years of history when it comes to this. So that just supports the fact that CTED has been under-recognised in the medical field. So to wrap up this video today, I just wanted to do a very brief outline about CTED in terms of the main symptoms and how to get diagnosed with it, just so that the information is out there and you can start to advocate for yourself if you're experiencing similar things, and you can go to your doctor and kind of present this as an option that they may not be aware of. So for CTED, the main symptoms that patients generally present with are a continued shortness of breath, especially upon exertion after suffering pulmonary embolism, exercise intolerance overall, fatigue, lightheadedness, presyncope and fainting, and chest pain or tightness. When presented with these symptoms, the diagnosis that the doctor should put in place involves imaging that shows persistent pulmonary vascular obstruction, which in English means that there is a blockage in the lungs still, and this could either be clot or scar tissue. For me, that stemmed from having a follow-up VQ scan, but it could also be done by having a CT, possibly with contrast, or even an MRI. The second part of diagnosis would stem from when there is no evidence of hypertension at rest. So testing could involve a stress test, EKGs, ECGs, lung function testing, or the absolute gold standard test, which is the cardiac catheterization. And if you want to learn all about that and you can stomach a bit of a longer video, I made a very in-depth video on that in November after I had my procedure. So I am yet to receive my appointment for BPA and get all of the details around having to travel to Toronto and stay there and how long things might take, how many sessions I will need. So when I get all of that, I will make a full-on video about BPA and kind of take you through my journey as it does start to happen. But for now, I wanted to make sure that we had this update on actual CTED and get the differences out there between that and CTEPH, because CTEPH I do see everywhere, whereas CTED, it was kind of like a little new to me. Even though there are resources out there about it, it's not as widely spoken about. And then I just want to make sure that you guys have got information so you can advocate for yourself when you go to these appointments. If there are more conditions like this out there where people are highly under-recognized as what to do once hypertension's been ruled out, but you're still suffering in some way, this is just another avenue for you to kind of present that information and let people know that it exists and see if there's testing in your area to get to the point where you can get a diagnosis and look at getting some treatment for it. If you have any questions around the ins and outs of how I got here, then please do leave a comment down below. Other than that, I did make a video pretty much every time I had like a new test or a new update over the years, so you can also check out the other videos on my channel. But I'll be back soon and I'll let you know as soon as I've got any other relevant updates. And thanks for watching. I'll see you again soon. Bye.